Well, topping the news tonight, the Jamaica Gleaner is reporting that the first case of corona has been confirmed in Kingston. Jamaica's Health and Wellness Minister, Dr. Christopher Tufton, according to the paper, made the disclosure today, revealing that a female patient has been in isolation since yesterday after showing respiratory symptoms after disembarking a flight from the UK. Now, with this confirmation, Jamaica becomes the fourth country in the Caribbean to record the presence of COVID-19. According to a statement from the ministry, the patient's infection was travel-related. However, steps are being taken to prevent the risk of community spread. Now, measures include the dispatch of a health team to the home of that patient for assessment and initiation of public health measures, the identification and contact tracing for all possible exposed persons, and meeting of ministry officials with members of staff at the hospital and the necessary interventions being put in place. Right now, there are more than 118,000 cases of COVID-19 worldwide. Now, novel corona is continuing to spread across the globe, as we've said. Fortunately, the Bahamas has been spared so far, but health officials are gearing up for what seems to be the inevitable. Our Cleopatra Murphy has more.
There are more than 113,000 reported cases of the novel coronavirus or COVID-19 spanning the globe, and more than 4,000 deaths have been reported to date. Italy, with some 60 million residents, has been placed under lockdown to manage the virus after 9,172 cases of coronavirus have been confirmed and 463 people have died in that country. As global infection rates increase with more testing, questions arise over whether the country has sufficient ventilators to support patients should the disease hit Bahamian shores. Minister of Health, the Honorable Dr. Dwayne Sands, could not say how many were currently available in the country.
We have had several ventilators donated in the Dorian response, and so I am finding out exactly how many we have at doctors, how many we have at the RAND, how many we have at PMH, and how many additional that were just donated. So expect an answer very shortly.
Considering long-standing issues of overcrowding and limited space at the Princess Margaret Hospital, the Minister of Health says health officials have begun the process of building an on-site special unit to manage patients with severe acute respiratory illnesses, including COVID-19.
That'll be a 6-bedded unit on the PMH, and we have also agreed a design for the unit at the Defense Force Base, which will be a 20-bed unit inclusive of intensive care space. And that process is moving as rapidly as possible.
While there are no confirmed cases of the virus in the Bahamas, the minister says health officials have the capacity to test, providing an update on testing capacity.
We have just under 400 tests. There may be fewer because we have been validating the tests. So we have gotten tests through PAHO, we've gotten tests from a supplier in Asia. Doctors Hospital has testing ability.
Sands says officials have already identified a response team to deal with any confirmed cases of the coronavirus, and that team is being built out in different places. The U.S. has reported 26 deaths, with 732 confirmed cases across 36 states. With the virus creeping closer to Bahamian shores, the Minister of Health feels the country is as prepared as it can be for an outbreak.
Obviously, no country can say that they had this in their plan or their budget for 2020. And so as rapidly as possible, at the level of the cabinet and all of the ministries of government, we are rolling out our plans. That has to be discussed with stakeholders, have input from various persons. And then what I believe people would like to see is, they've seen the health plan, they'd like to see the education plan, which is soon going to be coming out.
A budget of $4.5 million has been approved to address the deadly virus. Cleopatra Murphy, ZNS Network News.